دون أي خطأ. Question. With reference to the anatomy of the walls of the inguinal canal, which of the following is considered correct? Answer. The conjoint tendon forms the medial part of the posterior wall. Question. Regarding the blood supply and lymphatic drainage of the kidneys, one is considered false. Answer. The renal veins drain directly into the portal vein. Question. Which one of the following is considered the largest branch of the celiac artery? Answer. Splenic artery. Question. The root of the lung is made up of all of the following, except, answer, trachea. Question. The right gastroepiploic artery arises from the answer, gastroduodenal artery. Question. One of the following structures is connected to the hilum of the liver. Answer. None of the listed structures. Question. The parietal pleura that lines the inner surfaces of the ribs, intercostal spaces, sides of the vertebral bodies, and back of the sternum is named. Answer. Costal pleura. Question. The superior rectal vein is a tributary of the portal circulation and drains directly into the answer, inferior mesenteric vein. Question. Scarpa's fascia represents the answer, deep membranous layer of superficial fascia. Question. The conjoint tendon is formed by the fusion of the lowest tendinous fibers of which muscles? Answer. Internal oblique and transversus abdominis. Question. The blind-ended pouch of the large intestine that is situated in the right iliac fossa is called, answer, cecum. Question. The small intestine throughout its entire length receives blood from the answer, superior mesenteric artery. Question. The upper central part of the anterior abdominal wall is supplied by the answer, superior epigastric artery. Question. The common hepatic duct is joined on the right side by the cystic duct to form the answer, common bile duct. Question. The duodenojejunal flexure is held in position and attached to the right cruciate diaphragm by a peritoneal fold called the answer, ligament of Treitz. Question. The following veins drain directly into the inferior vena cava, except, answer, splenic vein. Question. The anterior relations of the trachea and the superior mediastinum include all of the following, except, answer, esophagus. Question. The anterior and posterior cecal arteries are collateral branches of the answer, ileocolic artery. Question. Regarding the sciatic part of gluteus, choose the false statement. Answer. It extends from the opening of the major gluteal papilla. Question. The superficial lymphatic vessels of the anterior abdominal wall above the level of the umbilicus drain into. Answer. Anterior axillary lymph nodes. Question. The bronchial arteries are collateral direct branches of the answer, thoracic aorta. Question. Concerning the hepatic and pancreatic ducts, one of the following is false. Answer. None of them is false. Question. Regarding the peritoneum, one of the following is false. Answer. Retroperitoneal organs are completely covered with visceral peritoneum. Question. Retroperitoneal organs include all of the following, except, answer, jejunum. Question. Branches of the superior mesenteric artery include all of the following, except, answer, left colic artery. Question. Regarding the anatomy of the esophagus, all of the following are considered true, except, answer, the esophagus lies entirely within the abdominal cavity. Question. Contents of the spermatic cord include all of the following, except, answer, cremasteric plexus. Question. The superficial inguinal ring is a triangular-shaped defect in the lower part of the aponeurosis of which muscle? Answer. External oblique muscle. Question. Which of the following statements about the anatomy of the stomach is true? Answer. The fundus of the stomach is usually full of gas. Question. Regarding the right and left principal bronchi, choose the correct statement. Answer. Before entering the hilum of the right lung, the principal bronchus gives off the superior lobar bronchus. Question. The left and right gastric veins drain directly into the answer, portal vein. Question. The rectus sheath encloses all of the following except. Answer. All of them are enclosed within the rectus sheath. Question. The greater omentum is a two-layered fold of peritoneum that connects the greater curvature of the stomach to. Answer. Transverse colon. Question. Concerning the layers of the anterior abdominal wall, choose the false statement. Answer. The transversalis fascia is superficial to the internal oblique muscle. Question. Concerning the anatomy and structural organization of the kidney, identify the statement that is actually correct. Answer. The upper expanded end of the ureter is called the renal pelvis. Question. Which of the following is a branch of the superior mesenteric artery? Answer. Middle colic artery. Question. Which of the following is a direct branch of the celiac trunk? Answer. Splenic artery. Question. Which of the following structures is not part of the root of the lung? Answer: trachea. Question: the right gastroepiploic artery is a branch of the answer: gastroduodenal artery. Question: all are muscles of anterior abdominal wall except answer: latissimus dorsi. Question: regarding anatomy of the urinary bladder, which is true? Answer: none of the above. Question: the rectus sheath encloses all these structures except answer: internal iliac artery. Question: the false answer about the inguinal canal is answer: the superficial ring is a defect in the aponeuroses of the internal oblique muscle. Question: all are true about anatomy of the peritoneum except answer: intraperitoneal organs that is covered only anteriorly with visceral peritoneum. Question: the false statement about the esophagus is answer: gastroesophageal sphincter is an anatomical sphincter, not physiological, that exists at the lower end of the esophagus. Question: regarding anatomy of stomach, all are true except answer: cardiac opening which controls the outflow of gastric contents into the duodenum. Question: blood supply of the stomach involve all of below except answer: pancreatico-duodenal artery. Question: according to the duodenum, all are false except answer: the duodenojejunal flexure is held in position by a peritoneal fold, the ligament of Treitz. Question: which of the following not a part of large bowel? Answer: ileum. Question: about the difference between large and small intestine, all are true except answer: the small intestine has tinea coli and haustration. Question: the false answer about the appendix is answer: the appendix lies in the left iliac region. Question: portal vein is formed by answer: A plus C, superior mesenteric vein plus splenic vein. Question: regarding the diaphragm, all are true except answer: it is formed of central muscular part and peripheral tendono. Question: the esophageal opening passes all these structures except answer: inferior vena cava. Question: all are components of mediastinum except answer: lungs. Question: superior mediastinum consists of all these structures except answer: heart. Question: the false answer according to the spleen is answer: it lies in close to the left 5th, 6th, and 7th ribs. Question: regarding pancreas, all are true except answer: the main duct of the pancreas opens separately in the minor papilla. Question: which is true according to the biliary system? Answer: cystic duct and common hepatic duct form the common bile duct. Question: which of them not a component of porta hepatis? Answer: inferior vena cava. Question: which of the following is true about anatomy of the liver? Answer: the liver is completely surrounded by glycine capsule. Question: which of the following not an organ of the urinary system? Answer: suprarenal glands. Question: regarding the anatomy of kidneys, all are true except answer: each kidney continues with the urethra directly. Question: the valves of the heart, all are true except answer: aortic and pulmonary valves consist of two semilunar cusps. Question: wrong answer according to the heart blood supply. Answer: venous blood of heart drained into the left atrium. Question: about the great vessels, all are true except answer: pulmonary vein carries deoxygenated blood from the heart to the lungs. Question: regarding the rectus sheath, all are true except answer: it is formed by the aponeuroses of the external oblique muscle only. Question: which of the following is false atypical rib? Answer: 7th rib. Question: regarding the inguinal canal, all are true except answer: the superficial ring lies in the midway between the anterior superior iliac spine and the symphysis pubis. Question: according to the anatomy of lung, which is false? Answer: the left lung is divided by the oblique and horizontal fissures into 3 lobes, the upper, middle, and lower lobes. Question: all are true regarding the anatomy of bronchi except answer: the left bronchus is divided into superior, middle, and inferior lobar bronchi. Question: regarding the anatomy of heart, all are true except answer: the base of the heart is formed mainly by the right and left ventricles. Question: regarding the pericardium, all are true except answer: fibrous layer consists of visceral and parietal layers. Question: regarding the small intestine, all are true except answer: the ileum is wider, thicker walled, and redder than the jejunum. Question: regarding the large intestine, all are true except answer: the anal canal has a voluntary internal sphincter. Question: about the gallbladder, which statement is false? Answer: it has a capacity of about 500 milliliters and stores bile. Question: All are in anterior relation to the trachea except answer, esophagus. Question. All lymph from stomach passes and ends in answer, celiac lymph nodes. Question. The anterior 10th intercostal space at right side is supplied by answer, musculophrenic artery.